have been using the UltraPulse for at least 8 years. We use it for a number of indications. A lot of it for hypertrophic scarring, for skin rejuvenation, for acne scarring. And we have started also using it for some radiation fibrosis as well as a new potential treatment for radiation injury. In terms of radiation dermatitis, we actually do not know very clearly the prevalence of radiation dermatitis. However, there is a published article in the New England Journal of Medicine speaking about the number of patients affected by chronic radiation injury, particularly in breast cancer patients. And the data thinks that it's about 33% after 10 years of the patient who have had breast cancer and treated with radiation develop some form of chronic radiation injury. We don't know particularly the types of the radiation injury, whether it's telangiectasias, fibrosis, combination of both, hyper or hypopigmentation, but definitely a large number of patients are affected. And there seem to be about at least more than 10 million worldwide patients affected by breast cancer. This statistic does not include patients who suffer from head and neck cancer, lung cancer, sarcomas, or other kind of cancer, which are also high likelihood of developing chronic radiation injury. Unfortunately, because there has been no movement towards treatment options for these patients in the past, they are not aware that there's something we could potentially do. Therefore, we are not getting referred these patients from the oncologist or radiation oncologist. And so awareness need to be raised with the medical community about potential treatment options that are been proven and under study for these patients and to help them having a better quality of life. Actually, the reason why we got interested in using the UltraPulse for chronic radiation injury is termed from our humanitarian effort. We actually started a clinic in Vietnam in 2009 to treat children with hemangiomas. And these children at the time was being treated with radiation, radioactive phosphorus in the treatment of hemangiomas with chronic radiation scars on their skin. They have fibrosis, depigmentation, telangiectasias, as well as xerotic skin, changes in texture that can affect their function. They also have a lot of contractions of those scars. And Luminous is one of the companies that were very helpful. Luminous donated a device, an UltraPulse CO2 device, to an organization, which is a 501(c)(3) nonprofit organization founded with conjunction with Dr. Rox Anderson, Dr. Martin Mim, Dr. Stuart Nelson, and Dr. Thuy Phụng, who are physicians from the U.S. With the donation of the device, we were able to look into potential treatment options, and one of them was for scars. So when we look at these patients, we see, there's a lot of scarring and fibrosis, and we know that the UltraPulse has been used successfully to treat hypertrophic scars. So we started to think whether there's a possibility of using the UltraPulse to treat radiation scar, because there is no treatment for these patients and they have to live with this horrible disfigurement for the rest of their life. So that was the motivation for us for using the UltraPulse to treat radiation scars. In terms of the future for radiation and dermatitis, I think we need to understand a lot more about the pathophysiology of healing from fractional laser treatment. We have to understand how the scar remodels, whether the scar that is irradiated remodel the same way as the scar that has not been irradiated. And understand, we actually are conducting clinical trials right now at Massachusetts General Hospital and Wellman Center for Photomedicine concerning the use of using the UltraPulse to treat radiation scars. And our hope is that we can better understand the settings, the parameters, the type of scars, the response to the laser treatment, and therefore can develop a way to help these patients with chronic radiation injury.